Hi, I'm Dr. Chong Choon Seng. I'm a Colorectal Surgeon practicing in Mount E Hospital.
Hi, I'm Ellil. I'm a president of the Ostomy Association of Singapore, and I'm also an ostomate and have been one for the last 13 years.
Hello, my name is Esther. I'm a clinical nurse specialist practicing in Sozo Wound Stoma Care.
So, do only old people have stomas? Well, the answer is no. Actually, there are many young patients who also can have stomas. And these kind of conditions can be like inflammatory bowel disease, we also known as IBD, like Crohn's disease or ulcerative colitis. So, Esther, when is the youngest patient that you have for stoma?
Okay, my patient is only 15 years old when I first saw him.
Wow.
Yeah, and the diagnosis was like, it's actually he had cancer of the colon, which is like, quite rare, right, in such a young patient, but it does happen. Yeah.
I mean, coincidentally enough, just a few days ago, a young patient reached out to me. He's 21, he's still in national service, and he now has to struggle with permanent stoma because he has Crohn's.
Oh dear.
Yeah, so we are trying to provide the support that we can for him.
But the good thing is, even with stoma, such patients can continue to actually live their life.
Yes.
And as long as they are able to cope with the changing of stoma, then actually they live pretty much a good, healthy life still, isn't it?
That's right.
That's true.
Who says you can't eat your favorite food after having an ostomy? You can eat pretty much whatever you want, right? I mean, look at me. I'm a foodie, right? I have had my stoma for 13 years, and my favorite food is kway chap, right? And I really dig the pig trotters and my bak kut teh, and not forgetting my nasi biryanis and my nasi padang, right?
Wow.
But the general advice is eat anything you want, but in moderation.
Yes.
And also eat healthily because you are getting older, so you need to make sure you have a balanced diet, but you can still indulge in all your favorite foods.
Yes. I always advise that whatever that they can eat before their surgery, they can continue to eat. But of course, there will be certain guidelines, like immediately after the ostomy surgery, we always advise low residue diet, firm, and it's also best for them to keep a diary, a food diary, so that they will know, which food is more they can tolerate more, which food, if let's say give them a lot of gas, they should eat in moderation, right? And Dojo?
Yeah, in fact, that's very sensible. Actually, all it takes is a period of adjustments. From the immediate post-operative period, where you don't take that much fiber, if the stoma comes from a small intestine, then perhaps taking more foods that gives you diarrhea, a lot more watery stools may not be so good for you, but you have to adjust based on your condition.
And I also think that every ostomate is different. So you really need to listen to your body and adjust accordingly.
Stoma bags are bulky, ugly, and obvious. Who says so? Look at me. The only thing bulging is my tummy. That's because I love eating, right? So when I go and do my support work in the hospitals, right, and we visit the patients who are newly diagnosed, they do not believe that we have a stoma because they look at us, we are well dressed. Sometimes I go in my sports attire, right? So the products nowadays are very modern, and they give a very close fit. And nobody knows that I have a stoma unless I tell them.
So especially for female ostomate, they are very concerned about the body image, having a stoma and the stoma bag, whether will it be obvious from the outside. So nowadays we have very good product, as what Ellil has said. We also can have a disposable bag and small bag that can actually hide it underneath your clothing very easily.
Yeah, in fact, that's very true. We have a lot of patients with stoma, and a lot of times you really can't tell that they are patients until they actually tell you so. That's the real truth. Because the fact that stoma are nowadays the appliances really fit very well, and they really are always underneath the clothes, unless you wear really tight clothes. But I remember I had a patient where he still goes scuba diving, even with the stoma bag. And that can tell you that how tight it can be, and still people can't tell. Now, different stomas can be of different sizes. Some stomas are a bit more flush, some stomas are a bit more protuberant, and that's why different appliances help to make the fit well so that it doesn't leak, which is the main problem for stoma bags.
That's true.
Yeah.
People with ostomy are smelly. Is it true? No, not at all. It's more of like psychologically they feel like they are smelly, but in fact, actually they are not. Nowadays, right, the appliances that we have is very good. They have like anti-filter and they have charcoal inside, and then that will dispel the smell. And I always advise them to watch out for the food that they eat.
Yeah, so personal experience, right? I have a lot of friends. In fact, I think I have too many friends. So I'm a very social person, and a lot of times we have these gatherings where we sit around a sofa and quite close, and no one has so far complained about any smell. But the important thing is to make sure that you're very good fit, because more often than not, the smell comes from leakage, right? So if you spend some time making sure that you have a really good fit, then it is something that you don't even think about, right?
That's a very good point. The fit is very important. I think the emphasis is correct. If the fit is right, a lot of times the smell is actually kept within the bag. Of course, there are filters that allow gas to escape naturally, but more often than not, if they feel that the bag is full of the flatus, which is the gas, they actually have a chosen time for them to go to the toilet or the place where it's convenient for them to let go of the gas. I think that sometimes probably I smell worse than them, because why? I couldn't control my flatus sometimes, oops. But if I have to let go at an inconvenient place, that actually makes me more embarrassed. So are ostomies permanent? Well, the truth is, there are ostomies which are permanent, and more often than not, they're also temporary. It depends on the medical indication. So most of the time, it requires to be permanent if, number one, there's no way of restoring the anatomy or the continuity of the gut. Number two, it might be because of patient's conditions that doesn't allow us to reconnect. Last but not least, sometimes it's really because the stoma was brought out for a palliative reason, which means that it is for a condition where the patient does not have a long prognosis left, and so the stoma is brought out so that there can be a relief of blockage. For all other reasons, any patients with like colorectal cancer or infection of the gut or emergency surgery that requires the temporary access of the intestine into the outside tends to be temporary after their acute condition settles or after the cancer has been treated. Usually there will be a way where we can reconnect the stoma and thereby allowing them to pass motion through the normal passage.
That's true. So like as compared to decades ago when I started practice, I'm seeing more temporary stoma due to advances in surgical practices. Yeah, so nowadays I see patient more for temporary stoma. So if let's say for a cancer patient, the temporary stoma usually will be needed throughout their chemo period. And then after chemo and everything is okay, then that will be the last lap of their cancer journey, is to put back the stoma. This is really a very good news for them, because this is something that they really can look forward to, that is the end of the journey. Yes, and it is the finishing line. So usually when I have such patients, when the going gets tough for them, especially during the period of chemotherapy, I always encourage them, like, the end is, you are going to see the light soon.
Yeah, so having said that, right, my stoma is permanent. As I said, I've had it for 13 years. Like what Dr. Chong mentioned, it was because I had rectal cancer and the tumor was very near the anus, so there was really no choice. So I accepted it after a while, right? And I also want to say that having a permanent stoma sometimes can be a blessing, right? Because there are a lot of things that you can do which other people cannot do. Right, like you can be standing in a very long queue, right, and you suddenly need to poo, right? You can just do it there and there. You don't have to look for a toilet, right? So I mean, this is looking at the bright side. Yes, there are some things you can't do with a permanent stoma, but there are a lot of things you can still do. So I just met at my last conference a mother of 3 whose favorite sport is scuba diving, and she was so worried she couldn't do it. And just before the conference, she went for her first dive after she had the stoma created, and you can see the joy in her face, right?
Yeah.
Right.
I also have some patients with temporary stoma. Sometimes when they put back, they may have more complications, because like there's a lot of when they have undergoing major abdominal surgery and there's a lot of scar tissue inside the abdomen. So putting back may may not be so good, so they will consider not putting back. Yeah.
And that frequency of stools actually affects not just the quality of life, but sometimes their work. Now you know the truth.
It's time to spread awareness.
And change the way you look at ostomates.